You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Eldercare. For years, I have been helping families, medical providers, doctors, case managers, social workers, nurses find the right solutions for seniors in transition, whether that is after a hospital stay, a rehabilitation stay, or when the care needs at home have become so much that care is needed. We assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder process can be, and I wanted to be that guide and a resource for families and professionals. Each week on Navigating Eldercare, we tackle the real questions and challenges that families and providers face during a care transition. I have spent the last 30 years working as a registered nurse, specializing in geriatrics, and I have dedicated my career to advocacy and care transition planning. This podcast brings together my experience and my passion to support you on your care journey. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with families, clients, and providers to create a customized care plan. When someone is needing more care, such as transfers, bathing, dressing, we provide them with options such as residential care homes, assisted living communities, memory care communities, and community resources that come into the home. We advocate, guide, and educate throughout the entire process that we work with families. Most importantly, we provide ongoing solutions and support. And you can reach us at 210-669-2222 for any type of support, resource, or advocacy. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Welcome to Navigating Eldercare. I am your host, Laura Daniels, and in today's episode, we will discuss how we at Care Advocates guide families through one of the hardest decisions, and that is moving someone into care, which could be a residential care home, an assisted living community, or a memory care community, and what our referral agency and placement agency does and how we work. This is something deeply personal and incredibly important. How families find the right care and the right home when they're overwhelmed, scared, and unsure of where to begin. Finding the right care. So what happens when your loved one is no longer able to live on their own? Have you ever wondered when is the right time for you to move your mom, your father, your spouse? One of the hardest decisions that families face is knowing when is the right time for you to seek care for a loved one. Often that moment comes when they are no longer able to safely or consistently care for themselves, or when a caregiver's emotional, physical, or practical capacity has been reached. Signs that care may be needed include a decline in physical or cognitive abilities, increased safety risks such as wandering or multiple falls, noticeable strain on the caregiver's own health and well-being. Seeking care is not giving up. It is choosing safety, dignity, and support for both your loved one and for yourself, the caregiver. Deciding when it is when it's time to move a loved one into care is one of the most emotional and difficult crossroads a family can face. It is not just a logistical decision, it is a heart decision. It often comes with layers of love, guilt, fear, and much uncertainty. Many families struggle because there is rarely a single clear moment. Instead, you get all of these small signs that begin to add up. I had a spouse call me at 9 o'clock last night, crying and just anxious and upset because she didn't know if she was making the right decision to move her mom. The time to explore care options is often when your loved one can no longer consistently or safely care for themselves, or when the caregiving demands begin to exceed what one person or family member can reasonably provide as far as care goes. Key indicators may include increasing confusion or memory loss, frequent falls, missed medications, changes in hygiene, wandering, resistance to care, or emotional and physical exhaustion for the caregiver. Equally important is recognizing when your capacity as the caregiver has reached its limits. Caregiving burnout is very, very real. When caregiving begins affecting your health, relationships, sleep, emotions, or work, it is no longer sustainable or safe for either of you. Let me simplify this. Seeking care, seeking placement, it doesn't mean you are giving up. It doesn't mean you love them any less. It means you want them to be supported, dignified, and safe. And you want to maintain that relationship you have with your mom, your dad, or your spouse. Instead of being that caregiver, that cook, that nurse, everything in between, and not lose yourself in trying to meet their care needs, that now requires a team. You want to be that family member, just that daughter, just that spouse. And many times as a caregiver, that relationship, it can feel strained and you start feeling resentment at times. Moving a loved one into care, it can be a turning point, one filled with relief, stability, and renewed connection. It allows families to shift from doing everything into being present, engaged, and emotionally available. And once again, being that daughter or spouse, just family when you visit them once they move into care. Choosing care is not the end of your role. It is simply the beginning of a new chapter where love continues, just supported differently. We will take a closer look and expand on signs and patterns that can help you determine when it may be the appropriate time to transition your loved one into care. So let's talk about stability, safety, and the ability to self-care. If you have noticed or noticing that your loved one is struggling and can no longer perform daily activities such as bathing, dressing, or toileting, that's one sign. Safety concerns. Are they having multiple falls? Is that may pose a risk for themselves or for others due to confusion. Mismanagement of health is another big red flag. If they're forgetting to take their medications or can't manage their chronic health conditions by neglecting appointments, missed appointments. Looking at their home, if they're unable to keep up with a household, no longer able to maintain a safe, suitable environment, if you notice that the refrigerator is empty or they're not eating well, those are all signs. Cognitive and emotional changes, memory loss and confusion. If they experience confusion about time, place, or other people, that can lead to missed meals or even back to forgetting to take medication. Missed appointments. Social withdrawal, very common. If you notice that your loved one is losing interest in their hobbies or their favorite shows that they once watched, friends, if they've become isolated and depressed. Changes in behavior are another red flag. If you notice that they are experiencing mood swings or other changes in behavior that has progressively, maybe this has progressed into something more like dementia. And another very real issue that we see a lot is caregiver burnout. If you are overwhelmed, that's because you obviously care. So if you're experiencing severe burnout, stress, or fatigue, this can make it very difficult for you to provide consistent quality care for that person that you love and that you're caring for. The inability to provide needed support, your home environment or schedule is not equipped to provide the level of care that your loved one needs, because not only are you caring for your loved one, but you also have your own obligations, such as work and your own family. And that's when you need to consider care options for your loved one. And the next steps is really planning and deciding how to do this. Keeping a log of incidents that have happened, behaviors, dates, circumstances that can provide you a clear picture into the situation. And maybe consulting a professional, a geriatrician, a specialist that can give you a comprehensive assessment, maybe a cognitive assessment, and ask them for their recommendations as well. Discussing this with other family members involved. Don't take all of this upon yourself. Bring other families into the picture and have that conversation with your loved one. Always focusing on safety, focusing on their care needs, their preferences. Frame the move as a way to enhance their quality of life and allow you to focus on you just being that daughter, that spouse, that loved one for them, rather than their full-time caregiver. Then start exploring options. Research the different types of care facilities, such as assisted living communities, memory care communities, big and large residential care homes, to really understand the services out there and really go out there and tour some of these communities. And that's where we come in. We take you on a guided tour based on your loved one's budget, location, care needs. I always say this, 90% of all the placements that we do, that families that move into care, happen at a moment of crisis. Mom fell and fractured her hip, dad walked out the front door. It is so important to be prepared and anticipate this before so that you are not overwhelmed when you have to place your loved one into care. Planning ahead is very important. Being proactive before a crisis occurs. As I've said before, emergency placements are usually what we do, and they can be very stressful for everyone involved. Have you ever wondered where to start when you were thinking about finding the care for your loved one, when thinking about care options? Then I'm going to walk you through what our referral and placement agency does and how we at Care Advocates, myself, Laura Daniels, why no one should have to navigate senior care alone, especially during a crisis. It is not surprising that many families come to us overwhelmed, scared, or unsure of what to do after a hospital stay, after a fall, or after a diagnosis. Sometimes they have very few days to plan what the next steps are going to be, what the care options are. Sometimes we do it as quickly as just hours. I had a particular placement this morning. Justin's mother was in independent living, and she walked out the door and into a street. They sent her to the emergency room. They couldn't keep her in the hospital, so I was called. They were recommending memory care placement. So things can happen very quickly in hours, and that's why it's so important to plan ahead. Our job is to guide you through every step, from understanding the care needs to identifying budget, location, preferences. We tour care options and finally helping you with the transition safely into the right environment. And the best part is that our services are at no cost. We guide, educate you through every step of the transition of the placement process at no cost. And today I'm going to talk a little bit about how we walk you through step by step and what happens when a family calls Care Advocates and how we support you, what that looks like after someone moves into assisted living, memory care, or into a residential care home. When you are facing this, you deserve clear information and someone who will walk beside you through every step of the transition process. So if you ever think about what care would look like for your loved one, navigating senior care is very complex and emotional. Most families do not know the difference between what an assisted living community is versus a memory care community versus a residential care home. When we talk about in-home care, caregivers at home, home health versus hospice, families are often overwhelmed and exhausted, or even in crisis. And you can eliminate a lot of that confusion. We provide the clarity, the options that you need for you to make a confident decision into the next step. Most families do not plan for this stage of life. It often just happens to them gradually, and then sometimes all at once, like the example I just gave you. When that moment arrives, it can feel very overwhelming and very frustrating. There are emotions, questions, fears, and the weight of wanting to make the very best decision for someone that you love. And when they do, they need someone who understands the care system, the available care options, and the emotional weight behind making all of those decisions, sometimes quickly or sometimes within a few days. That's where we come in. Families need to feel supported. We are a team of nurses, certified dementia practitioners, national placement specialists. But beyond our titles, we are people who have walked this journey with hundreds of families, and in many cases are our very own. We understand both the care system and the human side of these decisions. Most importantly, we are advocates who understand clinically and emotionally what your loved one is going to need. And how do we know all this? Our role is to carefully guide you, support you, and match your loved one with the most appropriate and safest care settings. We take the time to understand who your loved one is, their medical needs, their personality, their psychosocial needs, their routines, what brings them joy, what brings them comfort, what did they do when they worked, what do they enjoy doing now, and to provide them with that dignity and respect that they need. We also consider the caregiver. That's so important. The person, we're not just working with that person that we're placing, we're also considering the loved one, whether it's a spouse of the same age. We have to look at their needs as well. We partner up with over 100 trusted care options, including assisted living communities, memory care communities, residential care homes, and we also work with independent living communities. Each one is thoroughly vetted. We ensure safety, quality, dignity, and compassionate care. We know all of the communities very well. We know who the owners are. We know the rates. We know the turnover. We know as much as we need to know. We understand them very well. We know the floor plans, the layouts to make a good placement. You do not have to do this alone. We walk this journey with you step by step. We walk beside you until you feel peace, clarity, and confidence in the decision that you make. This journey can take anywhere between a few hours, and sometimes it takes weeks and maybe 30 hours over a 6-month period or years. There are families that we work with and we go out and tour. An example I can think of is I had a spouse whose wife had dementia, and we toured 4 communities. He wasn't ready to place her, and 6 months later he wanted to go and look at them again and tour again, and he still was not ready to place her. So a year goes by and we went back and toured. So this can happen very quickly, as in the example I gave you of that emergency placement. And sometimes the process can take, hours and over the span of months or years. When families come to me, they often say, I do not know where to start. And I tell them, you don't have to do this alone. That's what we're here to do. From the moment we connect, your journey becomes our journey, my journey. I walk with you. I listen to your fears, your hopes, your questions, your uncertainty, and I help you make that a decision that feels thoughtful, supported, and right for your loved one. For me, at Care Advocates, this work is more than a career. This work is deeply personal, and helping you make a decision that you feel confident and at peace with is not just my role. This is truly my calling. It is a commitment to guide, advocate, and honor your family member, your loved one, every step of the way, as well as honoring you and making sure that what you want for your mom and dad and spouse, that all of those needs are met, not just the care needs, but everything else that goes with it. This is not just about finding a place, a residential care home or a memory care community. It is about finding the right place where your loved one is safe, supported, and treated with dignity, and where you can breathe again. And so how does this process work? How do we begin doing this? When we get a referral, it's typically from a hospital or a rehabilitation center or a hospice nurse or a social worker or just a family member themselves. They call us, and from the very first conversation, we take very good notes. We are asking everything about their mobility, what are they able to do, what are their care needs, diagnosis, preferences, location, where do you live, what area works for you. We're asking about budget, who's involved in the decision-making process. We then start researching places based on budget, location, care needs, unique situation. And a unique situation that can be somebody with a dog or someone with a colostomy bag, someone that has insulin. There's a lot of unique situations. And based on all of our experience and all of the care options that we have and all of the settings that we work with, we will give you our top recommendations. We create a short list. We go with you to tour these places. So we accompany you on a guided tour. That is where you get to meet the owner, see the community, see the room, ask your questions. We guide you through all of that, and we advocate and support you every step of the way. After placement, this is part of the journey. This part of the journey does not end once we place your loved one. In fact, for us, it's where a new phase of support begins. After a family chooses a care setting, we stay connected because we want to make sure the transition feels right, the care setting meets the expectations, and your loved one is adjusting comfortably. These check-ins are never about replacing a community or moving someone again. This is just to make sure that nothing has been missed, advocating when needed, and ensuring your loved one receives the care, dignity, and respect that they deserve. We encourage families to communicate with us if anything comes up, because placement is not just a transaction. It is a relationship built on trust, advocacy, and a shared commitment to your loved one's well-being. It's not the finish line. It is just the beginning of ongoing support. Placement is not about finding a room or a community. It is about finding the right home with the right care at the right time. And families deserve someone who will walk with them throughout that entire process. The emotional journey from guilt to peace. One of the most common feelings that families experience when considering senior care or placing their loved one is guilt. It is very normal, it's human, and it usually comes from love, not failure. Families often tell me, I promised I would never move her. I feel like I am giving up on her. I should be able to do more. What they do not always see, at least not right away, is that transformation that happens after the loved one is safely placed in the right care environment. Once the move is complete and their loved one begins to settle in, something shifts. Instead of carrying the full weight of caregiving, exhaustion, fear, burnout, and constant worry, families begin to feel relaxed. They see that their loved one is surrounded by caregivers, trained staff, nurses, activity staff, activity director, and other people like them, their age, that they can connect with and have that social aspect. They see structure, meals, medications, support, engagement, and that human connection, that sense of fellowship, sense of community. Their loved one is safe, supported, engaged, and seen, and no longer alone. Many families share this sentiment with me weeks later. What they tell me is, I wish I would have done this sooner. So remember, placement is not the end of care. It is the beginning of better care. And when the right environment is chosen, thoughtfully with guidance and compassion, both the resident and the family experiences that relief, dignity, and emotional safety. Imagine walking into where your loved one is placed, whether that's a community or a residential care home, where the staff knows their name, their favorite music, they greet her with a smile, not because they have to, but because they truly care. Families deserve that support. Our commitment is simple: care, compassion, lifetime support. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Every family deserves guidance, compassion, and clarity during one of the most challenging transitions of their lives. If someone listening today feels lost, overwhelmed, or unsure of where to begin, where to start, please know that you do not have to do this alone. Care Advocates is here, and we will walk with you every step of the way. We will help you find the right care with compassion, clarity, and respect. Thank you for joining me on Navigating Eldercare, where we bring guidance and answers for every step of the elder care journey. If you are a family member, hospital case manager, or healthcare provider, and you know someone facing a change in health or planning for a future care need, Care Advocates is here to help you find the right care at the right time, whether it's assisted living, memory care communities, residential care homes, or bringing trusted community resources into the home. We walk alongside you every step of the way. Give us a call for a free consultation, and remember, our services are at no cost. You can reach me, Laura Daniels, at 210-669-2222. You can also listen to past episodes on YouTube or listen on your favorite podcast application. You can also listen to us here every Sunday at 8:30 on 9:30 a.m. The Answer. I am Laura Daniels, and this has been Navigating Eldercare, helping you find the right care at the right time for people that matter the most.
This has been Navigating Eldercare with Laura Daniels, providing guidance and answers for every step of the eldercare journey. For a free consultation, call 210-669-2222 or email laura@advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.